These are groups that have a broad impact across the Durham space. And we are working with them to provide things that the community has identified as key issues for them, and we're providing resources to help them get that to their communities. Whereas if we can improve that, we can really improve health outcomes in a number of communities all at once.
They have received very poor care, and they've been neglected, and they've been disrespected. So now they don't go to doctors. They hesitate to go because it's a bad experience, and we want to change that.
Hi, how are you? And it's telling you, it's giving you the ins and outs on type 2 diabetes, high blood pressure, strokes, ways that you can get early prevention.
Thank you so very much. I appreciate you stopping in and sharing with me.
Yes, thank you very much.
I'm gonna ask you a question.
Okay, ask me a question.
Do you enjoy helping the community?
Yes, I do. Because one day somebody helped me.
Because give it to the community that gives back to you.
Yes, if you give to the community, it will surely give back to you. My name is Midori Brooks. I'm a community health worker in East Durham, and I work for Communities in Partnership. Doctors always say you should go to the doctor once a year. That's true. Make sure you go to the doctor. Make sure you get yourself checked out. It's so important. It is so important. I have different doctors I have to see. I may have to see the lung specialist. Now I have to see the liver specialist. I also see a heart specialist. I have to go see an eye doctor twice a year instead of once a year, as well as my primary care doctor. It has affected my lungs, my liver, and my spleen, and it's affecting my left eye. With the sarcoidosis, I have asthma real bad, so I have to use an asthma pump. So your breathing, I have shortness of breath real bad. I take high doses of steroids every day in order to live. I now know how people in the community feel. If you have something going on and you don't get a better understanding of it, you don't know how to get a handle on it. I go out and get literature from the different areas like high blood pressure, diabetes, sarcoidosis, and I give it out to the community. I go door to door and talk to these families and see what's their needs. I feel like if they can get early prevention, to be able to talk about what they have and the precautions of what to do with it, it will better help them as a person.
My name is Julius Wilder. I'm an associate professor of medicine here at Duke University in the Division of Gastroenterology. One of my important roles here at Duke is to serve as the co-director for the Community Engaged Research Initiative. And in that setting, I have an opportunity to work very closely with the Durham community and helping to identify what are some of the issues that they may have around health issues, within the community. And it's in that setting that I've been able to begin to build these partnerships. Particularly working in this space, have really benefited from individuals who are innovative in the way they think about how they can leverage their resources and health literacy expertise to address these issues within communities of color. This is with organizations like the Durham Men's Health Council, our Latin 19 group, and we are working with them to provide resources around health literacy.
There's several factors that lead to kind of this diagnosis of depression in the Latino immigrants and their families. And that's the stress experience in adapting to life in the US. It can be experienced by immigrants themselves or the adolescents who might be born in the US but are also within an immigrant family.
In one space, it might be providing resources around interpretation so that health literacy can be provided in a language relevant to them. In other spaces, it might be ensuring we provide healthcare resources around pamphlets and those kinds of things that are at a level that's understandable and meaningful for that community.
The Men's Health Council is a group of volunteers that work with me as an advisory group and as a support group to help get African American men in Durham County involved in our health promotion activities. So we do things like outreach, they do education, they do training. The Men's Health Council has a monthly walk.
The walks began in 2017. Durham County Health Department has sponsored the Men's Health Council beginning in 2014 with the planning of it. And I'm super, super happy about what has happened over the years.
I warmly welcome you on behalf of the 280 plus men and women of the Durham County Department of Public Health, where we are fiercely committed to protecting the health and well-being of the citizens of Durham County. This is one of our prized possessions, well supported. I can assure you that whether I'm the health director or whether I'm gone, we will continue to support this effort because this is good ground right here.
It has greatly improved my health because when I'm not walking here, I walk basically most mornings 5 days a week, about 3 miles. And before the day is over, I've got about 8,000 steps in. At my age, I'm interested in staying healthy. I'm 69. I want to live longer than my father.
Oh, it's benefited me tremendously socially. It also gets us out in the community. I was part of a small group of men who used to run in East Durham. And we ran in East Durham because we wanted the community to see Black men doing things positively for their health, other than just running from the police. So this was pretty much in line with that philosophy. We're trying to be as visual as possible to let the community know that we are health conscious as well.
Before these events, I would say I was a regular exerciser. So I usually try to find some level of exercise. And so this helped me be more consistent with the walks. It's allowing us to hear about different topics that we might not know about, hear about, or really drill down on things that will be beneficial for us and our families.
Thinking about ways to improve clinical trial participation is a key issue for us right now in research. Not having these people as parts of these clinical trials means that we're creating oftentimes clinical trial results and in some spaces having medications approved that have not really been properly vetted in the communities that may be most adversely affected by the disease of study. So in that setting, we've got to be very intentional about and thoughtful about how we engage those communities so that they're comfortable participating in clinical trials.
The main focus of my job is to figure out how I can increase the participation and enrollment of underserved and underrepresented communities or participants in clinical trials at the Duke Cancer Institute. Because one of the things that we've noticed is that a reason that people either are hesitant or don't participate in trials is sometimes they don't even know people or know someone who has participated or know someone who's successfully gone through it that looks like them. So one of the things we're trying to do now is kind of alleviate some of that hesitancy by showing that there are success stories or there are participants or people who have come and have participated and have had good experiences and has helped them in their journey through either cancer or other types of health.
One of the biggest barriers to these communities participating in clinical trials is that we don't ask. We just assume they won't participate because we all know the legacy of Tuskegee. We know the issues and the trust issues that might be associated with that. And so as researchers, we just don't ask the question at all. And so the other piece of this is we shouldn't allow our bias to lead to us not even engaging at all. We should always be transparent and authentic and ask all of our patients about participation in clinical trials because they actually may be engaged.
Today I'm here to do a healthy cooking demo for the Men's Health Council, and I am highlighting the benefits of eating a plant-based meal with fiber. Research shows that for folks of color especially, a plant-forward type of eating style is going to help us to better manage any chronic issues that we might have, and it can also help us to prevent the onset or prevent developing any of those chronic issues. And the ones I'm speaking of are things like high blood pressure, high cholesterol, and diabetes, right? So we want to be able to protect our hearts to live a long, healthy life.
I think diabetes was probably one of the most recently diagnoses that many people got. Many of them knew they had high blood pressure, but they hadn't been going to the doctor to check it. So also having these programs where they are able to go in and get checked makes a difference. Whether they are diagnosed for the first time or they realize it's out of control, I need to manage this.
I don't think it's just one thing that has caused this prevalence. It's probably a combination of factors, and we have to kind of identify all those factors and address all of them in order to decrease our rates of things like high blood pressure, diabetes, cancer.
So to really have a significant impact in that space around health literacy, we have to begin to understand from their point of view, what are their health issues? We need to understand where are the gaps in terms of issues around the various relevant health outcomes, and then work with those communities to not only create the interventions to improve health literacy as it pertains to whatever health issue we want to talk about, but at the same time also work with them over time to ensure that the intervention we create with them in partnership works. If it doesn't work, working with them to tweak it and make sure that we are doing something that is effective and positive in that space.
Are y'all ready to eat? Yeah. Okay. I feel like that's the most exciting part. You want to start? Come on.
When I reflect on what success looks like, it looks like our partners in the community doing this work in a sustainable way, and they're no longer dependent necessarily on what we're doing. The community has ownership over its health issues, is able to identify resources to address those health issues, and over time is able to help direct community members to the care that they need. That sustainable care and ownership by communities. Communities and their understanding of the various health issues, understanding how to address those health issues, basic knowledge around various diseases and how they play out. That's important because that allows those communities then to make decisions and to focus their resources and spaces to ensure their communities are healthier. Because we've given them what they need to be self-perpetuating and to be able to address all their own needs in that setting. It is this piece, this idea of connecting quality of care you provide with the other needs in the community, but this is a unique opportunity to not just help individuals, but to help communities.